Hi everyone, I'm Dr. Williams, and at this point in time, almost everyone in some shape or fashion has had their life affected by the coronavirus. Isn't it startling how one virus can change the entire world? Every day we hear about events and conferences getting canceled throughout the world. It's like the nightmare that just keeps on going. Public officials all around the world are advising people to take precautions, as the only possible solution at this time is to be prepared. But there's so much more than meets the eye. So, what can one person do? How can you prevent contracting the coronavirus? Well, here are some possible solutions. First, you should recognize the signs of COVID-19. Patients with COVID-19 present with fever, sore throat, body aches, and a shortness of breath. In some cases, this has led to severe respiratory problems, kidney failure, and death. The coronavirus is most commonly spread through respiratory droplets when the infected person sneezes or coughs. These respiratory droplets can travel up to 6 feet. A common way of getting infected is coming in direct contact with the person infected. This means kissing, hugging, or shaking hands. So how can you prevent contracting the coronavirus? Here are some steps that you can take to protect yourself. You want to wash your hands before and after cooking, cleaning, shaking hands, sneezing, coughing, pretty much anything that you do, make sure you wash your hands. Use a disinfectant soap or hand sanitizer. Now, if you don't have access to hand sanitizer, you want to make sure that you're using at least 60% alcohol. So that means the vodka sitting in your cupboard is not the solution. The next precaution you want to take is to avoid public gatherings. If you're 60 and older or have pre-existing conditions like diabetes, hypertension, asthma, COPD, or bronchitis, your best bet is to just stay home. Avoid crowds at all costs. You also want to abstain from traveling to high-risk countries like Iran, China, South Korea, and most of Europe. Also want to make sure you stay prepared. Proper preparation allows for you to be ready in case of an unfortunate event. Keep all necessary supplies at home in case someone needs to be quarantined immediately. You want to stock up on water, all prescriptions and medications, pain relievers, disinfectants, toilet paper, and food. If you're feeling that your symptoms match COVID-19, you want to seek professional help immediately. Whether you have COVID-19 or not, you want to always cover your mouth when sneezing or coughing. Most importantly, never cover your mouth with your hands. Always use your elbow. If you're using the tissue, make sure you dispose of the tissue immediately. If you believe you're infected by the coronavirus, wear a mask, as wearing a mask could decrease the spread of the respiratory droplets. Because wearing a mask can only prevent you from infecting others, but it cannot prevent others from infecting you. Due to the growing panic, the demand for the masks have gone so high that it's created a shortage in the market. So it's advised to leave the mask for people who actually need it. As a dentist, it's not my intention to protect myself from the patients that I'm working on, but to protect the patients in case there is any accidentally spit or respiratory droplets that may come out while talking. Outside of surgical masks, the N95 respiratory masks are highly effective at filtering out airborne particles. Now, these masks should only be used by a health professional, especially while treating people with the coronavirus. They have to be custom fitted and require adequate training. All masks are for one-time use only and become ineffective after prolonged use. You want to avoid touching your face at all costs, because any contact with the coronavirus can enter the body through the eyes, nose, or mouth. The most important thing to do is to not panic. With a wide coverage on the news and social media, there's a lot more worrying that's happening than is necessary. The best one can do is to stay calm, take the necessary precautions, and be prepared. If you suspect that you've been in contact with someone with COVID-19, the best thing to do is to isolate yourself. If you start to develop symptoms, you want to contact a health professional immediately. If you believe you've contracted the virus, you want to avoid public transportation at all costs. You want to avoid any contact with family, friends, or neighbors, and you want to stay isolated in a separate bedroom with a separate bathroom. Finally, you want to avoid the use of any antibiotics. Antibiotics are only effective for diseases caused by bacteria. After all, this is a coronavirus, and the antibiotics will have zero effect on it. If you have any questions or need to reach out to a health professional, feel free to contact me on social media or at paulwilliamsdds.com. Most importantly, stay safe out there.